A test for total bile acids is the most important test a woman can have. Many women will know that we have done a big research study that showed that there are thresholds above which there is an increased risk of spontaneous preterm birth, that is 40 micromoles per litre, and above which there is an increased risk of stillbirth, and that is 100 micromoles per litre. So a total bile acid test will tell clinicians and women whether they're likely to fall into those high risk groups. There are a couple of other points women should know. One is that there have been 2 recent studies now that have shown that total bile acids increase after women have eaten. One of them came from our own group, and we believe that this means that women should have their bile acids checked after they have eaten, because what we want to know is the peak level. We don't want to know how low it can go. We need to know how high it can go, because that tells us whether they're in the high risk groups for the complications of pregnancy. The one other thing women would want to know is that in our study in The Lancet a couple of years ago, where we showed the threshold, we showed that for the highest bile acid that was measured at any stage of the pregnancy. And something that women or clinicians sometimes ask me is, if a woman had a high concentration and then it came down, can we stop worrying about them? And the truth is we don't know, because the research was for the peak any time in the pregnancy. So I would say if a woman has had a bile acid concentration above 100 at any stage, we really should think of her as being in that high risk group.